HPV is extremely common. Up to 80% of the population will be diagnosed with, HPV
And what
or
is
have
it?
HPV. So it is the most common sexually transmitted virus.
Okay.
And it, in most people, causes no manifestations. But
So you don't know you have it.
That's right. And
Okay.
unless you get, an HPV test, which has just been unrolled across Canada and in the States last year, and in Canada this year, we're now doing HPV testing. Prior to that, we were just doing Pap tests.
Okay.
But HPV testing is more specific and it catches more abnormalities than Pap testing. So it's actually a great initiative that the governments in the States and Canada have rolled out.
Okay.
But what can happen in a certain subset of people, so there's high-risk HPV strains, and those can lead to cervical cancers in women. And in men, it's leading to rapidly increasing rates of oropharyngeal cancers, so cancers of the throat, the tonsil, the oral pharynx.
Really?
Yes, and that is in some demographics, those rates are actually rising beyond cervical cancer rates in women. And a lot of people aren't aware of that. And so you'll see a lot of men, typically over the age of 40, who will be getting these oropharyngeal cancers that used to be rare. And it's the HPV virus that is, implicated in the disease progression of that. Exactly.
Got it.
Yeah.
Got it. Wow.
So 17 years ago, my best friend had rapidly progressing abnormal cervical changes. So she got her Pap smear. She was told, okay, abnormal Pap smears of undetermined significance. Went back several months later, was told, it's now SIN1, so cervical intraepithelial neoplasia level 1. Went back 6 months later.
Easy, super easy.
Level 2.
So that means not awesome, but not super bad yet. One is kind of like lower of the range.
That's right. So it means you have these abnormal cells on your cervix that are changing from normal, on that spectrum towards, precancerous to cancer, but they're level 1. And she went back, they were level 2. So once you hit level 3, you're looking at, okay, now you're on the cusp of cervical cancer. And once you hit level, 2 or 1 that's persisting, there's often interventions that are, that are employed. So you might see something like a cone biopsy or conization, where they literally cut out a part of the cervix. Or, there's cryotherapy, there's like freezing or ablation. So, removing some aspect of the cervix in some way is what's done. And so, and women typically, as they're on this continuum, are told to watch and wait. That's the standard of care, right? So you go and you get your Pap smear and, it's abnormal, and you're told to watch and wait. And
don't panic.
That's right. And then, sadly still now to a large degree, there's not any guidance on nutrition, on, how immune function can actually help you to optimize your cell function on a cervical level and help those cells regress back to normal. There's no recommendations on lifestyle. But of course, we have data to support all these things. We have data on, nutrition, on immune optimization, on lifestyle. So it's an unfortunate lost opportunity. And in a way, it's a microcosm for a lot of things in women's health, right?
Yeah.
Sort of a lost opportunity in terms of these gaps that exist in women's healthcare, where we have an opportunity to really turn things around early and prevent the need for invasive procedures, not just with cervical health, but on so many different aspects of women's health, right? And so...
sorry, go ahead.
I was just going to say, it speaks to a need of like filling gaps in a much bigger picture than just this.
I would agree. And so Peter Attia's book, Outlive, is something that I've talked a lot about around here, mostly because my physician, when I stepped into sort of perimenopause and had, I needed a blood transfusion. My hemoglobin was at 50. We couldn't stop the bleeding. All the things were happening as things were changing. And so, we're like, let's have a conversation about, what do we need to be looking at earlier in our lives instead of just treating, we knew for a long time that my iron levels were dipping, the A1C was going up, all these things were changing, but it's like, it's okay. You're pre everything. So let's not worry about it. But I think this is such an interesting shift in a time where we have access to so much more information, what we do about it. There seems, as you said, gaps in the system between, okay, so this is good, but it's not flagging anybody really yet. So we're just sort of waiting. And is this true? This is true also in
absolutely
obviously in
and
this
I think
space.
we should circle back to how this relates to women's health. Largely, we can come back to menopause, for example, and some of these other things. Yeah. So in the case of my friend, it's kind of circling back down into this cervical microcosm. She was told, watch and wait. There's nothing actionable you can do. And she had this it was a conization procedure that was scheduled for about 5.5 months out from this day where she called me and said, I need your help. I know you're studying medicine, and I know that you have access to these doctors who focus on what I'm going through. Could you consult with them? And, you have access to PubMed. Could you see what's going on? What are other countries doing? What are they doing in Japan? What about medicinal mushrooms? Where else is there something I can do actionable? That's actionable while I'm waiting for this conization procedure. So I did. I contacted, there's this doctor in Portland, Oregon named Tori Hudson. There was another doctor in New York. They focused on this work and they'd published research on it. So I consulted with them and I consulted with PubMed, and I pulled together this protocol for her that incorporated, what does an optimal immune supporting diet and lifestyle look like? Yeah. And we pulled in some evidence-based supplements that were used, things like, folic acid that had showed, some optimization of cervical cells compared to placebo in a human clinical trial, reishi mushrooms, a few different nutritional things that you could take and supplement for them. And when she went in for her conization procedure, not just a follow-up to look at the cervix, but for her conization procedure, her OB-GYN said, your cervix looks clear. This is very strange because it was rapidly progressing abnormalities. Wow. And now it looks clear. So this is strange. And, she had this acetic acid solution she applied that enables you to visualize the cervix more clearly, or the abnormalities on the cervix more clearly. That looked clear. She did a repeat pap smear. That came back a few days. She called my friend. That was also clear. At that point, she called me and said, this is strange. What's going on? And I said, I'd love to send you, what Tori Hudson and what this other physician are doing, and this research that I found and what my friend was doing. And I sent it all to her. She was like, this is fascinating. I actually never seen any of this before. And, it'd be nice if you could make this publicly available. So that was the start of my sort of pivot, because I obviously never intended to focus on this direction.